Welcome everyone. Welcome to another episode of Wellness Bites with Gauri. And today we have a really wonderful guest, a very special guest. She's a wonderful friend of mine and she's an excellent clinician as well. And that is Dr. Sailaja Golla. And it is my privilege to have her on my show today. So, welcome, Dr. Sailaja Golla, to our podcast today and also our session we are going to have today. And today's session is going to be very interesting. We're going to talk a lot about autism and things as well. So let me talk a little more about Dr. Sailaja and her accomplishments as well. So Dr. Sailaja recently joined the TIND on September 1st, 2019. Before that, she was a faculty at the UT Southwestern Children's Health and Associate Program Director of the Neurodevelopment Disabilities Residency Program for the UT Southwestern Center for Autism and Developmental Disabilities at Children's Health Dallas. Dr. Golla, she earned her medical degree at Vijayanagar Institute of Medical Sciences. She completed her residency in pediatrics and neurodevelopment at the Brooklyn Hospital Center and the Women and Children's Hospital at Buffalo. She has also completed additional training in pediatric neurology and neurodevelopment disabilities training at UT Southwestern, where she won the Leon Wisberg Award for Outstanding Research Manuscript as a resident. She is a first graduate from the Neurodevelopment Disabilities Program at UT Southwestern Medical Center and one of only 8 such training programs in the country. She is board certified by the American Board of Psychiatry and Neurology in neurology with special qualifications in child neurology. Dr. Golla has lectured and presented on autism, genetics, and pediatric neurology at numerous national conferences and meetings. She has also authored multiple textbook chapters on neurological conditions. She has been invited to be a panel advisor for Rare Disease Research Network and serves on the International Affairs Committee at the Child Neurology Society. Dr. Golla is also an active researcher, and she has participated on multiple national and multi-center clinical trials as well. Dr. Golla participates in many parent associations, including Autism Speaks and the Pitt Hopkins Foundation. Her expertise has earned her recognition, including America's Best Physician Award for the National Consumer Advisory Board, the Texas Super Doctor Award, D Magazine Best Doctors in Dallas for 2019, the D Magazine Best Doctor Award for Collin County and Dallas, and the Mom Approved Doctor Award in the DFW North Texas area. In her free time, she hosts interactive radio shows and live autism podcasts in the field of autism and other neurodevelopment disabilities to help spread the community awareness. Dr. Golla also enjoys dancing and cooking. She also speaks English, Hindi, Telugu, and Kannada. So, Dr. Golla, welcome to our show today.
Thank you very much, Gauri. That was a very detailed, thorough, comprehensive introduction. That's very sweet of you. I am privileged, and thank you so much for inviting me on the show.
So, Dr. Golla, hearing about your accomplishments and things, I feel so happy to have you on our show today. So, tell us a little more about yourself and what makes Dr. Sailaja Golla unique.
Okay, I believe you have already told enough about me. So anyways, I'm a pediatric neurologist, trained in pediatrics and neurology. But in addition, I think what's unique or different about me, I should say, is I did an additional training in neurodevelopmental disabilities, specifically autism, ADHD, learning disabilities. Which makes me a little different from a general pediatric neurologist because in addition to pediatric neurology, I do specialize with behavior and development in these needed children who have neurodevelopmental disabilities. So I do a bit of combination of medications, like what a psychiatrist does, like a pediatric psychiatrist does, but also I do some evaluations like a developmental pediatrician does, in addition to treating all the comorbidities with autism, like neurological conditions, whether it be seizures, sleep difficulties, in general headaches, and so on. Autistic children can have a lot more of these neurological comorbidities higher in proportion compared to normal children or their peers.
Okay. So wonderful, Dr. Gola. I mean, there's so much to you and so many facets and things that you have about yourself, so many accomplishments you have. So, Dr. Gola, since we're going to talk a lot about autism and things today, so the first question I have for you is, can you tell us a little about autism and what parents need to look for in terms of signs, symptoms, or any red flags?
Very good question and an important question. Autism, it's termed as a neurodevelopmental condition. Obviously, it affects the brain, but it also affects multiple other things. Like the kid can have difficulties with their development, speech, communication, two-way communication is one of the biggest issues with autism. They can have trouble walking. And you can't believe, Gauri, it's 1 in 60 boys now, according to the CDC, and 1 in 90 girls, which is so common. In a classroom of maybe say 20 plus 20 plus 20, there might be a child with autism. It's that common compared to what it was several years back. Some of the red flags we need to look for in autism is typically around 15 to 18 months when a child is developing normally. For example, they have speech and you need to have so many words and they need to be walking, running, socializing. There is some sudden regression in certain children. Typically around that age, they stop speaking or they struggle with two-way communication. So there could be regression or they could just be slow. They're not talking as much. In addition to that, they have what is called as stereotyped repetitive behaviors like clapping of the hands, spinning in circles, lining up of toys, stacking up of blocks. They like routines, transitions upset them. So those are some of the typical red flags we need to watch for as providers, caregivers, parents, teachers around the age between 15 months, anywhere it can go to 2 to 3 years.
So that is really a wonderful explanation, Dr. Gola. Other question that comes to my mind is, what causes autism?
So in the past, we always thought there is no cause for mom. And there was this refrigerator mom theory where you blame the mom for everything. The child is autistic because of the upbringing, or the mom did not take proper care of the child or whatever. So I just wanted to bring up that interesting concept which existed several, maybe 50 to 100 years back. But anyways, until now, we did not have a real cause for autism or an identifiable cause for autism. Until recently, we know that 10 to 20% of the time, there can be a genetic cause. For example, it can run in families. Consanguinity, meaning like if they're married among close relatives, is another genetic risk factor for autism. In addition, certain brain abnormalities, whether it be prematurity or if maternal use of smoking or alcohol, some of those like the fetal alcohol syndrome, pre-existing conditions can predispose to autism. These are some of the common things. So typically I advise genetic testing and at times maybe an imaging of the brain, MRI of the brain to look for anything. But if there is a cause, like if the mom says, yes, he was born at 26 weeks or 30 weeks, and then there was a brain bleed or whatever, then that puts the child at higher risk for autism.
So since we were talking about genetics, Dr. Gola, is there any role of genes? Is it hereditary? If there is one child affected with autism, is there a risk for a second child?
Yes, definitely. And they say anywhere from 30 to 40% there is a risk if a sibling is affected. And if there is another child in the same family, there is a 30 to 40% risk. Quite often I get questions from moms who want to have a child or who are pregnant, have a child with autism already, and they say, what is the risk or how do I know? And it's very hard to know. You just have to take a chance. They do some maternal genetic testing, but again, nothing is highly efficacious. So there is still a chance, despite everything being normal, there is a risk. And if they are twins, there is a higher risk for them having autism. So if it's twins If the mom is pregnant with twins, it's much higher risk. Or if one twin has autism, the other twin has a much higher risk, almost up from 50 to 60% chance of having autism.
So that is very interesting to know, Dr. Gola, the genetic aspect to it as well. Now, do children with autism have limitations in their social skills?
Yes, that's one of the most important factors in diagnosing autism, even differentiating it from mental retardation or intellectual disability or cerebral palsy. Social skills is something very unique to autism. So they, like I said earlier, they can have regression of social skills anywhere from 15 months to 2 years. Like a child, for example, looking at the mom and waving bye-bye at around 9 to 10 months, suddenly stops doing that around 15 months. They lose eye contact. They want to be by themselves. They play by themselves. Sometimes when you take them to a park, they play side by side. They do not have interactive play. They do not actually interact with the other child, but they play side by side. And some kids just want to be by themselves. So these are some of the characteristics of course social interaction, in addition to behavioral challenges like hyperactivity, aggression, hitting, biting, kicking, self-injurious behaviors. They can headbang, they can rock their body, and so on. So these are all some of the social deficiencies or defects we see in children with autism.
Since we're talking about social skills and things, the other question that I have, Dr. Gola, for you is that do children with autism have language and communication problems?
Yes, that's a huge component as well. So language and communication and social skills with those odd behaviors are like the umbrella for autism, the repetitive behaviors. So language deficits could involve anywhere from being non-verbal, meaning absolutely no words at all, not speaking at all, or they can have few words, like speech delay typically, or characteristic of autism is they have something called as echolalia, where they repeat the words again and again. For example, you ask them, hey, what did you eat for breakfast? They say, eat for breakfast, eat for breakfast. And then you say, did you eat cereal? They say, cereal, cereal, cereal. So that's echolalia, where they echo the same thing again and again, or they could repeat the same rhymes. Certain autistic children can sing a whole song from the TV, or they keep repeating again and again and again. So that's one of the characteristics of autistic speech or language difficulties compared to another child who just has speech delay, for example. And another thing we see is some kids have totally normal speech. They can speak in full sentences. They have very high vocabulary, and they're usually termed as high functioning autism, but they are very tangential, or pragmatic is the right word I use, where they cannot communicate. I ask them, hey, how was school? What did you do at school? And they say, they talk about dinosaurs or something they want to talk, and they can tell you everything about the life history of dinosaurs, for example, but they do not answer your question. So the two-way communication is impaired, and they go tangential and talk about something else, what they want to. So these are some of the common language and speech deficits we see in children affected with autism.
So that is very interesting to know as well. Other question I had for you, Dr. Gola, is children with autism, are they at an increased risk for seizures, epilepsy, anything else? And do they have any sleep difficulties or insomnia?
Yes, unfortunately, it's a package. Children and adults with autism have about 30% of them have some sort of sleep difficulty. The most common sleep difficulty we see is insomnia. It could be trouble falling asleep or staying asleep. A 2-year-old child with autism can have really struggles with falling asleep, but then he wakes up several times in the night, to an extent that mom decides, okay, he's just going to sleep in our bed. That's not a good practice, but that's something which is quite common. The other sleep difficulty we see is snoring, where they snore a lot and they're at risk for sleep apnea. At that time, we need to get a sleep study and maybe get their tonsils removed and things like that. And these are some of the most common sleep difficulties, and very easily manageable. And I typically avoid like medications in children for sleep difficulties to begin with, at least. So
Mm.
melatonin is natural, and Gauri, you probably
Mm.
have a lot of natural remedies as well. They use those natural oils at the back of the neck, like rubbing at the back of the neck, which really helps. Those
Mm.
lavender oils and all those natural oils, and I feel that helps. I say yes, go ahead and use it if that helps. That's
Mm.
better than subjecting a 2-year-old child to something like a medication as such.
So that is really nice to know, Dr. Gola, regarding your views and things, and again how you manage and help with that as well. Other question I have, which is really common, is that are there any medical treatments for children with autism?
Yes and no. So right now we do not have a cure, like a magic pill which can cure autism or reverse autism. It's only therapies. Specifically, I want to mention applied behavior analysis, which is a special therapy for children with autism, where they help with communication and social skills. And it is, if you start early and give them at least 30 to 40 hours of ABA therapy, it really can reverse some of those signs and symptoms. Other than ABA, the rest of all the medications we have are more symptomatic as of today. So symptomatic meaning the child has seizures, you give them a seizure medication. The child has sleep difficulties, give them something for sleep. The child has behavior problems, give them medication for behavior, and so on. So they're all symptomatic, but it's not like a cure. And you can stop the medicine if behavior gets better, but it does not take the autism as such out. So they'll still have those behaviors, and it doesn't reverse the symptoms or stop the progression. That makes sense.
Okay, okay. And that is good to know that, when you touch base on that. The other question that I know that a lot of parents also have is that, can a child with autism attend regular school?
So that's a very good question. Again, they will be attending a regular public school, for example. But within the public school, there are different tiers, meaning like a child who has autism, for example, will be placed in something called a special education. And special education could be different levels. For children with autism, it could be an all-inclusive classroom. If the child is significantly autistic with severe behavior problems, non-verbal, not speaking, so he to be in a total autism classroom where he gets everything, so total special ed. And some other kids, they have partly they go to regular classes where they attend classes with regular children, and part of the time they're in the autistic classroom for certain subjects. Some children just attend the regular classroom and they get pulled out for speech therapy or behavior therapy or so on. Some children have like a teacher's aide, so different levels. They're still placed under the special ed umbrella, but the parent and the teacher get to decide based on the level of communication and the level of skills what exact services they need. But this is all in public school. So I think all the listeners should make sure that normally a child starts school at 5, but if the child is autistic or speech delayed or any sort of developmental delay, please go ahead and call the school district, and the school by law has to call you back within 90 days and set up an appointment to get a full evaluation, and the child can start school as early as 3 years of age.
So that is really nice to know, Dr. Gola, that, a child with autism can attend regular school. And again, that, there is help that in the school as well, that, when it comes to special education and things like that. In the current environment that we are, Dr. Gola, one of the common questions that the parents also have is, is the autism related to using electronics?
Interesting question indeed. So all of us use electronics. Gauri, we cannot survive without our phone. Like when I forget my phone, I need to okay, let me go back and get my phone right now. I cannot survive without my phone. It's like, hey, it's so much attached to us. But again, coming back to how does it affect children with autism and what impact it has. Children with autism have more tendency, like children today, they cannot survive with gadgets, but children with autism, they're just fascinated by gadgets, not just playing on them, but how it works. They try to peel off the parts, look at the back and see what's going on inside. So they are really, really addicted to gadgets. But the gadgets do not cause them. Some parents ask me, okay, when the child was 2 or 3 years, I did not pay much attention. I just put them in front of the TV or gave them the phone. Did that cause autism? No, gadgets do not cause autism. Children with autism are more prone to have gadget tendencies, like whether it be phones or watching TV. The role of the parent is to make sure that they do not spend more than 2 hours in front of the gadgets. And even if they do, make sure there is some intercommunication. Like when a child is watching a movie, for example, the parent has to sit with them and interact with them and make sure there's a two-way communication. Hey, what's going on the TV? What do you think it is? So it's more interaction rather than the child sitting alone and watching it on the TV or the phone. In addition, there are some good things as well with the gadgets. They have all these devices where you can learn speech, you can learn communication and all that. What I want to say is make sure the parent is involved, the provider is involved, and it's not just the child alone with the gadget.
Absolutely, Dr. Golla. I definitely agree with that. That everything has its plus and minuses as well, and that when something is offered to the child, especially electronics, the parents are to make sure that they are sitting next to the child and monitoring, what they're observing and what they're, how they're interacting and things as well. Thinking about the society and the community we live in, Dr. Golla, is what is the role of the community, and how should the community be made aware, or how should the community interact with a child with autism?
That's very important, and I should also say there is a long way to go. I think awareness in the community is very important. One thing we need to realize is we do not need to treat them as special or different. We need to include them as one of us. Is something we all need to learn. We should not say, oh, we should not pity them. Oh, okay, this child, poor child, has autism and let's stay away, or there might be some bullying at school with other kids and so on. So that's something which all parents and teachers and other children have to be taught, like how do you interact with the special needs child. That's very important. And also the families who have the special needs kids, they also need to take it out from them that yes, I should not have the denial thing. I should not keep my child separated. I should be bold and take him out and let him do the things what other kids do. So both ways there has to be acceptance from the parents of the child who is affected with autism, but also among the rest of the community. How do we spread community awareness? Maybe just talking about these things in school, maybe having a guest lecture, or including autistic children in something which normal children do, and like having something interactive like a play module or something like that. Visual stories help, so they need to include that as part of their curriculum, like maybe have a textbook chapter on that and how to do all this in addition to whatever they learn at school, social studies, science and all that, which is very important. In our days back in India, we had a subject called as moral science. I don't know if you remember, but yeah, that kind of help, like morally, how do we behave with everyone and how do we react?
So that is really nice of you, Dr. Golla, to touch base on especially the role of community and creating that awareness in the community as well. In the current environment that we are, Dr. Golla, a lot of the kids are now studying from home. They are doing a lot of their schooling from home. So especially for kids with autism, what can they do at home, and especially if they are bored? What are some other suggestions you have?
Yes, and again with the COVID pandemic now, it's really disappointing that everyone is home. Some of the suggestions, especially for special needs kids with autism and in general, I think very important thing is we are losing out on that social interaction, the bodily interaction. I know we are doing all the Zoom conferences, calls, virtual tea, virtual coffee and whatnot, but again, it's totally different. They're having virtual classes. Who
Mm.
knows? The child might be having a phone under the table and might be playing on that rather than listening to the teacher on Zoom. But yes, if it's in a classroom, the teacher can find out easily compared to on virtual Zoom. So it is challenging. So there are resources for children. American Academy of Pediatrics has provided a whole big resource list where
Mm.
pediatricians, providers, parents can go and look at it. There are some interactive games, but also now with the COVID slowing down a little bit, I do encourage some kind of social interaction, following the social guidelines. Parks are a little bit high risk because of the cleanliness, the slides and all that. So
Mm.
maybe if you go to the park, make sure you really follow strict guidelines. Some of the things I advise is biking, running out,
Mm.
even if it's with a friend. Biking is something which can be easily done. For children with autism, there is again Autism Speaks, which
Mm.
has made a whole list of things what you could do through the pandemic and how to help a child with autism with the social things. There are resources for parents because if it's a normal child, yes, you can do a Zoom classroom, leave the child alone and you can go to work. But if it's a child with autism, it's so much of a struggle how the parent has to lose their job or sit with the child.
Mm.
That's a struggle. And doing speech therapy, behavior therapy online, it's basically like nothing. There, the speech therapist comes online and tries to help the child. It's really difficult for a child with autism. So hopefully it gets better. It's a huge struggle. There is not like a clear answer. But Autism Speaks is a good
Mm.
website, and American Academy of Pediatrics. They have a lot of resources and things what they can do.
So that is just great, Dr. Golla, for sharing, your insights and as well as some of the resources, both on Autism Speak as well as you pointed out the American Academy of Pediatrics as well. Dr. Gola, one of the questions also I have is, a lot of times there's a lot of burden on the caretakers. So what is your take? Are there any resources, especially for the caretakers as well?
Yes, for the caretakers through this pandemic, there are a lot of resources for children with special needs. There are some funds available, also things which they can do online, where they could apply for a job or through helping other kids who are at home through the pandemic. Again, Autism Speaks is a really, really good website. Speech therapists and occupational therapists, it's still better to do something online rather than just not do it, is what I advise all my families. Just go ahead and do it because there's something going on rather than just stopping all the therapies.
Mm.
Having a therapist come home is an option rather than taking your child to the place because
Mm.
it's your home and you can sanitize and whatnot. And there is something in the news that hopefully there will be an act or something coming up for special need kids through the pandemic, so they could get some special funds through the government, also some special resources, because when they go to school, they cannot wear masks like other children.
Mm.
They just cannot
Correct.
wear it. So maybe they can provide them with some separate accommodations or something special, more special than what they used to do when there was no pandemic, providing separate rooms or resources, both for parents and the kids through the pandemic.
That is absolutely great, Dr. Gola, for pointing out all these resources and all this discussion we had so far with autism, and all your insight that you provided were absolutely wonderful and to the point. Absolutely. So, a few questions I want to ask you is more about what tips you have, wellness tips you have for the parents, especially for kids with autism, or even generally for most parents right now.
For kids with autism, again, I think acceptance is the biggest thing.
Mm.
And a lot of parents are suffering from anxiety and sort of frustration and a lot of things. Please seek help,
Mm.
talk to people. I think one thing we do not do is just keep it within ourselves and get frustrated,
Mm.
or maybe show that aggression on your child. Please do not do that. Seek help. There is help available for parents with autism as well, through Autism Speaks and other organizations. And again, social distancing is very important. So try to do as much as possible. There is a website called a Sensory World where they make like sensory friendly masks rather than the typical masks which we use in general for other children. Obviously, exercise and diet is a big thing. Sleep is another thing. With the COVID pandemic, online classes, kids sleep in late, everything is messed up. The parents sleep late. So sleep hygiene is very important. Use melatonin if it's because it's natural, or some natural oils, and make sure there is a schedule. Maintaining a schedule is one of the biggest tips I would tell for children, for parents with autism, because they go by schedules. Healthy eating, take them out. I know they're inside, they're junking on food, but please take them out for a walk. Again, walking in an open air when there is that social distancing, it is a good way to keep you healthy. It's hard to get a child on a treadmill. Normal children, it's fine, but for a child with autism, so just take them outside, outdoors, with social precautions, maybe walk or even biking, things like that. And please reach out to other families who are affected with autism, or in general, talk to people, friends, relatives, or whatever, and whenever you're frustrated or anxious about the current situation.
Absolutely, Dr. Golla, and great tips that you have offered. Now, what is your personal health and wellness routine?
Well, so there is a saying, preach what you practice, right? Or I have to say, practice what I preach, the other way around. So that applies to me, because I say a lot, but it's difficult for me to practice it myself. So like you mentioned, I do love to dance. So that kind of relieves all my tension and stress. That's one thing. I do like the concept of meditation and yoga, which has come through ages, and it just relaxes the mind, whether it be using an app like Headspace or doing something on YouTube. One more thing I find relaxing is just closing my eyes and taking a little nap, maybe a short nap, 15-20 minutes or whatever. I'm not a huge runner or a hiker or a gym person trying to build muscles or trying to do cardio, but yes, those are all good things and whatever works for everyone. But I want to stress the fact that mental health is as equally important as physical health. No matter how many calories you burn, make sure you eat healthy. You need that protein. You just cannot fast and not get your protein in the diet. So make sure you get your protein, but at the same time, find some form of physical, but do not forget your mental health. That's very important.
That is so good, Dr. Gola, especially that you mentioned, with meditation and, yoga and things as well. So that is just wonderful. We really have a good wellness routine as well. So do you have any update, any event and things you're going to be talking, or any update regarding your practice that you would like to share with the viewers today?
Sure. So I work for Texas Institute for Neurological Disorders, and I have multiple locations. We recently opened up a location in Arlington as well, Arlington, Texas. I have locations in Plano, Frisco, and Arlington now. So multiple locations where you can refer patients, and I can get them in within a week. I also do some radio shows, and there is one radio show in particular I do every week, which I want our listeners to be aware. It's every Monday on Chori, Tori live. It's in Telugu. That's my mother tongue. So they just got me for every week, or maybe at least every other week. And then I do some special podcasts to help children back home in India once a month, or maybe more frequently. So it's called as a new project, Mazhlai Project, Mazhlai. And all this information and more information, like tips for parents and my upcoming lectures, or anything in general, not just what I'm doing, but in general, something interesting about autism. My Facebook, I have an MD page. It's Sailaja Golla MD. So my first name, last name, and you add an MD. So on that page, I do post interesting information, whether updates about my shows, radio shows, or in general, anything new in research. in the field of autism and other neurodevelopmental disabilities.
That is just wonderful, Dr. Gul. I mean, the amount of, community work you're doing is absolutely commendable, as well. And definitely we will also post the links for your Facebook page as well. So, our viewers also can avail of those links as well. How can people contact you?
So my website is, if you just put in Texas Institute for Neurology, so you get multiple phone numbers, contact, how to refer a patient. So I work for Texas Institute for Neurological Disorders. So the best thing is just go to the website and you can find all of my information. And Gauri, I can share my card and phone number and my office information with you as well.
Absolutely wonderful, and we will have that information available, on our YouTube, as well as our podcasts and things as well, so that our viewers also can reach you. So, Dr. Sailaja Golla, it was wonderful, talking to you about autism, and there was a lot of information and a lot of resources you shared today. So, I'm very thankful and very grateful for you to come on our show and interact with our viewers and give so many insights as well. So, it was again wonderful to have you again on our show today, Dr. Golla. And to all our viewers, keep listening to our episodes, Wellness Bites with Gauri. It is available on our website, www.ayurnutrition.com/podcast. These podcasts are also going to be available in the Apple Podcasts, as well as Google Podcasts, and Amazon Music as well. This will be on our Facebook. So keep listening and keep tuning to Wellness Bites with Gauri.
Thank you.